So the National MS Society has been involved in value assessment through assessments from the Institute for Clinical and Economic Review, ICER. They have had 2 reviews of MS disease-modifying therapies. One was a class review, and the other was a review of siponimod for secondary progressive MS. So the Society has submitted comments and provided patient input and feedback to those assessments. So I guess the broader context would be engage with your national patient organizations if you can and if you have one. These assessments, there are timelines and deadlines that are very critical to meet. So asking your patient organization, your national patient organization, how they're engaging is helpful. And I think also too, as the person living with the disease that's under the assessment, you're an expert in your disease. And I think the most important thing to remember is that the people conducting these assessments, whether it's ICER or another value assessor, they're not experts in your disease state. They're experts in clinical effectiveness review and cost effectiveness review and value assessment. They're not necessarily experts in your lived experience with your disease. And I think that feedback is extremely critical, especially as they're kind of considering what evidence is out there and what evidence where evidence gaps are that can really impact the results of the assessment. So I think that's the most important thing that patients can do. It's very new. It's very new. I mean, people don't really know what value means. So when you say value, most people pivot to the economic, the money figure, value for the money, but nobody really can agree on what value means. So value to a patient is going to be much different, or value to a caregiver is going to be much different than value to a person who's used to doing cost effectiveness and economic modeling. And I think having a consensus agreement that we're all going in this from different perspectives can really inform the assessment and kind of transform it from being a purely economic figure to something that is more reflective of the disease state in the area. I think a lot of times people are confused. They really don't know what it means. They don't know how and why and what they're used for. The Society has engaged because we believe that these assessments could be used to limit care or to impact care in some sort of way. So we think it's important for us to engage. And I think just making sure that patients are aware that these assessments are out there and that they can be used to both limit care, but also in certain circumstances to back up evidence for care. So I think it's just important to know that they are just one tool that's out there in a very large, crowded field of healthcare numbers and figures.